Class 4 lasers include all lasers which can burn the skin and cause permanent eye damage. These lasers may ignite combustible materials and thus may represent a fire risk. Maximum permissible exposure, or MPE, is the level of radiation a person may be exposed to without hazardous effects or adverse biological changes. The nominal hazard zone, or NHZ, describes the space within which the level of radiation during normal operation exceeds the appropriate MPE. The Laser Treatment Control Area, or LTCA, contains the NHZ and is typically the operating room. There are two types of laser safety controls. Engineering controls. Engineering controls are part of the laser design and contribute to the safety of the device. These include safety shutters, emergency off buttons, interlock key or password, automatic standby when idle, and a foot pedal cover. Administrative controls. Administrative controls are supplemental controls which are to be carried out by personnel. These include warning signs posted conspicuously on all doors of the LTCA, staff required to wear proper protective eyewear, laser operated by trained individual, clear communication between surgeon and operator declaring laser ready and laser standby, fire extinguishers, fire drills, and window covers. Protective eyewear should be worn within the laser treatment control area. All protective eyewear should be clearly and permanently labeled with the optical density and wavelength. Patients are almost always in the nominal hazard zone. If the patient is awake and facing up, eyewear of choice should be goggles. For patients who are not awake, corneal shields or moistened eye pads should be used. Additional fire hazards to be cognizant of and avoid are related to the patient's preparation for the operation. Skin prep agents. All agents must be completely dry. Iodine-based solutions should be used instead of flammable alcohol-based solutions. Dark tinted prep solutions should be rinsed away. Cover the hair with wet towels and sponges. The hair should be free from alcohol-based sprays or gels. Oil-based lubricants should be avoided and lubricants for the eyes should be water-based only. Laser-generated airborne contaminants refer to the potential of live tissue in the vapor plume. To manage contaminants, a filtered contained system can be used to suction the plume. For personal safety, always use a laser-appropriate protective mask with a 0.1 micron filter. Thank you for completing Omniguide's laser safety training. This training is supplemental to and should not replace hospital and institution safety protocols. Please direct any questions or comments to your local Omniguide